My name is Cresta Duin, and I have been asked graciously by the VCRC to give you a presentation on exercise and how it relates to breast cancer. I've been an occupational therapist since 2001, and I've worked at St. David's Round Rock Medical Center since 2003. I got my lymphedema certification in 2005 and my oncology rehabilitation specialist in 2016. And I'm also the co-founder of Lymphatic Health Consultants, LLC. So what I would like you to know with this presentation are some of the benefits of exercise, some of the guidelines, the different types of exercise. Hopefully there's one for you. Exercise supporters or enhancers, things that make it easier for you to get going and exercise. Edema and lymphedema. I'm not going to touch on it too much. Angela, my friend, did a really great presentation on lymphedema, so please check hers out. And then, of course, scar massage and desensitization, just touched on, and then posture. So when we think about exercise and breast cancer, we kind of have to weigh the balancing the risks of deconditioning versus all of the benefits for breast cancer exercising throughout the treatment. Most studies are going to put you at 40 to 65%. I have seen one study that said 85% because they believe it's underreported of patients who are breast cancer survivors have some kind of disrupted arm and shoulder dysfunction by the time their treatment ends. So that's one, risk of deconditioning, losing function of the arm. Exercise also reduces the recurrence rate, the new diagnosis rate, and the interval between. Deconditioning versus exercising, pre-existing conditions and issues. We don't all come into the treatment of breast cancer healthy and functional. So it's even more important to maintain your function and regain some of that function if you can through treatment. Surgery is another risk of deconditioning. We have imposed arm restrictions and movement restrictions to protect the surgical areas that can lead to further deconditioning. During surgery, muscle and soft tissue and nerves get damaged. They can get stretched. They can just get irritated and cause some lingering numbness and tingling. And then, of course, inflammation with surgery can also lead to limitations in movement. Radiation is another modality of breast cancer treatment that can cause dehydrated skin, tight skin, reduced range of motion. And then the difference between restoration and remedial exercise and exercise, there is going to be, if you do have some of these shoulder impingements, frozen shoulder, soft tissue adhesions that are limiting cording, that's limiting your active range of motion, we're going to start with that restoration and remedial exercises and get you prepared and functional for pursuing exercise as a habit and a lifestyle. We've had some long-held clinical advice. The advice was avoid overusing the upper arm, which is still really good advice. Carpal tunnel, overuse type of symptoms, lymphedema, we don't want you to overuse your arm. But what that got translated into was don't use your arm. And that leads to further deconditioning. There's a lot of confusion about what you can and can't do. Hopefully we'll clear that up a little bit for you. So our new outlook on exercise is that it's proven to be safe for not only your overall health, but for multiple body systems throughout your body. The potency of exercise that you're going to start or do during cancer treatment or after the treatment of breast cancer is correlated to how active you were previous to treatment. And it's important to prioritize this discussion with your healthcare team. It's not always on the forefront. People don't always know that you're motivated to exercise and you want to maintain throughout the treatment sessions or the totality of breast cancer treatment. So it's really important to discuss that with your healthcare team so they can get you hooked up with a provider that has some expertise and can get you started on a program. The better that your baseline is before radiation, before surgery, the better your leaping point is going to be after those treatments are done. And it's proven that it's not only safe, But if you exercise or try to maintain activity from the start of your cancer journey all the way to the finish and beyond, not only are you more receptive to the treatments, your treatment goals are often easier to meet. You maintain your functional goals and your functional ability throughout the treatment session, so you don't have such big dips and dives. And then it really does help manage the mood and anxiety and stress. Exercise is part of managing lymphedema. It is one of the 4 tenets of complete decongestive therapy. And again, maintaining your functional baseline throughout the totality of your breast cancer treatment journey. And then posture, core, and buns, oh my. One of the hardest things for people to get to reorient with themselves is how to actually just even stand up correctly. So overwhelmingly, the cumulative research shows that a supervised, slowly progressed, controlled increase in physiological stress through strength training might actually be more beneficial to breast cancer survivors than acute stress from activities of daily living. And the analogy I like to give is like a heart attack. I'm from South Dakota, so we get our first big snowstorm of the year, and everybody is out there shoveling. A lot of people haven't been active through the fall, and they go out, and a lot of people have heart attacks. It's actually the first day of snow is when the hospitals see a surge of heart attacks. It's because they haven't conditioned that muscle. And same token, after you have a heart attack and intervention, we don't tell you to go home and sit on the couch and eat bonbons. We tell you, we get you into cardiac rehab and we exercise. We slowly control the exercise and strengthening of that heart muscle. And it's the same thing as if you were to go out and lift something really heavy with your arm if you're at risk for lymphedema. You can trigger a cascade of events that start some swelling in your arm. But the research shows that if you maintain your activity level and you slowly progress the strength and endurance of that arm, you're much less likely to have any kind of exacerbations with lymphedema. And if you do have an exacerbation, that those symptoms are much quickly brought back to control. And exercise is just really empowering. It helps control. It helps you regain that sense of like, I've got some control. You move from more of a passive patient getting all of these treatments done to you to taking ownership kind of your survivorship. It helps with pain and emotions. It helps reduce social barriers. There's a lot of community events that evolve around exercise. Mental acuity and focus helps regulate your diet, your GI. It curbs that accelerated bone loss. It offers cardio protection. So some of those treatments are cardiotoxic to your heart, but exercise does protect your heart. It improves balance, coordination. There's just a multitude, and you want to make this a habit so you can continue to benefit from those things through the duration of your cancer treatment and after. So when we talked about the remedial exercises and the restoration, our goals are going to be to reduce swelling, impingement. If you have frozen shoulder, those targeted shoulder exercises are going to be very specific to help rehab that whatever dysfunction is going on. Increasing the range of motion, reducing the cording if there's any, regain the strength, regain postural strength. Like I said, it's really hard for people to even get into that correct posture alignment. Our goal is to get you back and return to a prior level of function, and then scar management. So the goals of exercise. Before treatment, you want to just try and maintain the current level of exercise or start to become active. It's going to improve your recovery and improve your surgical outcomes. It's going to start you on that path of maintaining that function for the duration of your journey. It'll help regulate sleep. It'll help regulate mood. There's a lot coming at you all at the same time. So it's good to have that consistency and not feel so inundated and overwhelmed. Activity might feel harder to accomplish during treatment, and especially on those bad days, but the small wins count, so take them and just try and focus on consistency. You never regret the workout that you did. So During treatment, the goals are going to shift a little bit. There's going to be increased things that are going to be affecting your body, sometimes in negative ways or ways that you have to adjust to. So exercise can help mitigate some of those new things that are creeping in. You know, depending on your treatment, it's going to depend on the type of cancer, the activity tolerance that you have, your strength at baseline, and your social support. So try and get those in place in the first phase. And then just adjust your activity level as needed. You know, there are going to be more factors that are going to be affecting your body physiologically. So it's just a reminder to be patient with yourself and adjust accordingly. You may need to do shorter and lower intensity workouts during that time. And remember the isometric stabilization. Just, you know, holding yourself in a correct posture alignment 30 seconds every hour helps you form that new habit of standing up taller. And then as you recover from treatment, you're just going to continue to increase the activity as your side effects diminish. Be patient with your activity level. You can feel effects of radiation 18 to 24 months after the fact. So you might be trucking along just fine and have a couple of days where you just feel a little bit more tired, and that's okay. Just adjust, maybe do some flexibility, and then hit it hard when you're feeling a little bit more energy. Noticeable gains might be harder to see, but pay attention to the ones, you know, maybe you're not as winded going 15 minutes today as you were a week ago. You know, pay attention to those. Keep exercise fun and cross-train. There's tons of groups, there's tons of different activities. Most can be modified, so just explore exercise. Continue to recognize your achievements. And long-term side effects of chronic illness or managing side effects of cancer treatment can be challenging, but just remember that they also help regulate those curves and spikes so you have a better, more consistent baseline. You're not having big swings during the day. And then physical activity should be part of the your daily and weekly routine. These are just some ways that you can integrate activity into your daily life. Riding your bike, park your car the farthest parking lot that you can, that you feel comfortable walking. Use the elevator or use the stairs instead of the elevator. Walk your dog. Do some gardening. Just don't do it all in one day. Just different things like that that you can tackle, short 10-minute intervals, but do it several times a day. And exercise is really a flavor for everybody. This young lady, Deborah, she competes at the CrossFit Fitness Games, and I included her picture because she has primary lymphedema, which actually can be very challenging to manage for some people. But she can deadlift over 375 pounds, and she does accommodate for her lymphedema, but it doesn't stop her. So I wanted to include that to show you that there are no limiting factors to how high you can go in your exercise and fitness level after the treatment of breast cancer. There's a flavor for everybody. You know, you want to include the aerobic conditioning, strength training, and add flexibility. And you get to choose from a variety of different activities to get that happen. But the main goal is that you want 150 minutes of moderate activity per week. Peripheral neuropathy can be a limiter to starting exercises. Tingling, numbness, burning, temperature sensitivity, zingers, they can cause some difficulty with your balance, pain with standing or walking. It can feel like other orthopedic pathologies like carpal tunnel and things like that. Exercise is beneficial for it. Make sure you have good shoes. Warmth feels good. I did include some hand and feet exercises right before the reference section, so you can screenshot those and try those out if you'd like. And so the 7 basic rules. Strengthening, you want to start with the isometrics and isotonics first. So that's just holding your posture. So you're not contracting your muscle, you're not relaxing your muscle, you're just holding it. Start off at a slow pace and monitor yourself. Monitor fatigue as a guideline. Difficulty, you want to start simple and progress to more challenging exercises. I do get better. Speed, you want it to be intentional. Perform exercises at a moderate to slow speed. Weights, you want to start slow, 1 to 3 pounds, and gradually step up in different intervals, where when you step up in weight, you're going to step down in repetitions. Stretches, perform all stretches slowly and hold for at least 30 seconds. Our muscle's natural reaction to elongation is to recoil, so holding it for that 30 seconds is going to make sure that it's actually at a longer length when you're done with the stretch. And then try and always end with the deep breathing exercises. So the governing bodies that license athletic trainers, they actually put out some guidelines for breast cancer survivors, and they recommend avoiding inactivity, building up to 150 minutes a week of aerobic activity, strength training at least twice a week, and then daily flexibility to make sure not only that you're stretching that tight tissue that occurred during surgery or radiation or just with your posture, but that you're increasing your flexibility as well. Strength training, you always want to start this one with a supervised program. That's why it's important to get in touch with your healthcare provider team so they can hook you up and get you in touch with somebody who's professionally trained and can guide you in that. If you have any changes in upper body symptoms that last a week or longer, you want to get evaluated by a clinician for lymphedema or whatever. If you have new shoulder pain, be mindful with your overall arm work. If you do gardening today, skip the strength training today and do it tomorrow. And then back the resistance off after an exercise holiday. If you go on vacation for a week or more, 2 weeks, don't want to start right where you left off. You want to bump back down. So the National Lymphedema Network exercise guidelines on flexibility and strength, they say that it may improve, and it does improve lymph flow by decreasing scarring and tightness. You want to make sure to avoid overstretching. You don't want to cause any inflammation. Strength training modifications may be needed. Adequate rest between sessions is crucial. You need to make sure that that muscle has time to heal. And then modify your program according to your symptoms. Aerobic conditioning, it's beneficial for lymphedema. The deep respiration enhances lymph drainage. You want to avoid injury by starting really gradually. You want to avoid getting overheated. A good supportive shoes, especially if you're having some of that peripheral neuropathy. And then again, modify your symptoms or modify your program based on your symptoms. And then posture. Posture is very important. Avoid hunching your shoulders, rolling your shoulders forward, slouching, or having your shoulders up towards your ears. They're all going to be positions that you're going to feel like assuming after surgery or radiation. But if you maintain those unhealthy positions, it's going to be harder to get out of them, and it's going to delay your return to functional movement. And although we restrict your movements for the first few weeks, you can work on your posture, your breath control, your body position, your awareness in space. So again, the shoulders and the scapula are the building blocks of the arm. That's why posture is so incredibly important. But know how to progress yourself without increasing or compensating strategies. Use pain as an indicator. The slow, smooth, controlled movements. Don't rush, no jerking, shaking, or bouncing, no quick, swift movements. You want to make sure that you're increasing gradually, always monitoring your symptoms, intentional movements, and then again, the exercise holidays. Don't pick up where you left off. And the self-monitoring and ergonomics is a big one. I wanted to touch on posture again. Continue to protect yourself from overuse. Monitor the extremity during and after activity for size, shape, tissue texture, soreness, heaviness, or firmness. You know your body best. Pay attention. You need to wear compression garments if you're symptomatic or have a diagnosis of lymphedema. Prophylactically, talk to your healthcare provider. Again, monitor your body system and modify your exercise program accordingly. Make sure you have really good sleep positionings and ergonomics for work and leisure. You know, you spend a good deal of time at work. Make sure that it's ergonomically set up so you're not trying to fight those symptoms as well. Commit to the first 5 minutes If you still feel like quitting after the first 5 minutes, you know, it makes it a little bit more easy to not feel guilty about it. So the feedback loop with your healthcare team, make sure you alert your healthcare team if you get weaker, start losing your balance or falling, you have pain that gets worse or becomes sharp, or there's a new heaviness, aching, tightness, or other strange sensations in your arm, rapid or new onset of swelling or exacerbation of swelling. If you have headaches, dizziness, blurred vision, new numbness or tingling in your arms and chest, make sure you alert your healthcare team right away. Signs, edema and lymphedema, know the signs and symptoms, know the risk reduction, lymphedema risk reduction techniques, know what you can do to prevent it, and catch it early. It's easier to get back down to baseline. Scar tissue and massage, desensitization. I won't go over this too much, but it is really important. Scars can get sticky. They're a natural part of healing. They're kind of like the glue. That doesn't mean that they need to be impeding any kind of range of motion or limitation. So you want to do cross friction, up, down, back and forth, circular, other counterclockwise, all across that incision and anywhere tissue is a little bit tight. Just make sure there's no open areas. And these are the exercises for the peripheral neuropathy. A lot of it is just fine motor exercises, desensitization, different textures. For your feet, you can pick up marbles, scrunch a washcloth, again, just the different textures. Some people like the socks that have the individual toes. That sensation around each toe can make nerves kind of calm down, but they like a sensory-rich diet. So you can kind of have fun with those. One is my favorite is toe yoga. I wish I could show you how to do toe yoga because it's really quite nifty, but it takes a lot of dexterity in your feet, and I need to keep practicing. So I hope that was beneficial, and I hope that gave you some ideas and some structure around maintaining exercise or starting an exercise program. Thank you.